Fellow Bahamians and residents, this is Arinthia Komolafe, DNA leader. Today is April 6, 2020, and I am speaking to the issue of our response to the COVID-19 pandemic. Our country is facing the most difficult health crisis in recent memory. We continue to pray for the families, loved ones, and friends of those who have lost loved ones or caring for those inflicted by the coronavirus. This leads me to the question of testing for this virus. When will additional test kits be made available for testing more Bahamians and residents? We were advised that there are 1,750 kits available in the Bahamas. The World Health Organization, or WHO, has called for mass testing for this deadly virus, but we are challenged to increase our capacity to test due to limited supply and resources. Presumably, this is why we are only testing persons showing COVID-19 symptoms and not necessarily everyone identified through contact tracing. The problem with this is that some patients don't show symptoms. The other issue with this is that waiting on the showing of symptoms could mean that we test people at a time when their health has significantly worsened to the point that they stand less chance of full recovery. A look at the number of deaths against the number of confirmed cases shows a disturbing trend for the Bahamas. The WHO estimated the global mortality rate at 3.4% on March 3, 2020. As at March 5, 2020, the mortality rate for China is 4.1%, the US 2.8%, Italy 12.3%, Spain 9.5%, Iran 6.2%, the UK 10.3%, and France 8.4%. The mortality rate for the Bahamas stands at 17.2%, higher than these countries. We must do something urgently to reduce this mortality rate and flatten the curve. This statistic, if not improved, will ultimately cast doubt on the management of this crisis and/or the quality of our healthcare system. Both of these are not positive reflections on our country. An increase in testing would likely increase the number of confirmed cases and may reveal a lower mortality rate, or it may expose a gap in our response to this pandemic. Early detection could help slow down the further spread of this virus and save lives. Until the government is able to get more test kits for mass testing, all persons identified in the contact tracing exercise should be tested. There should be better management of the self-isolation and quarantine process. It is obviously clear that we have a community spread of this virus. We still don't know when the first Bahamian or resident contracted this virus, and we don't know how many people have been infected. Let us continue to follow the instructions given by our health officials on hygiene, social and physical distancing, and please stay at home. We will get through this together. May the Lord keep, protect, and shield you from this plague that has visited our nation and the world. God bless you, and God bless the Commonwealth of the Bahamas.